Hello, a pleasant good morning to everyone. Really very happy to be here today and being able to also share similar experience with my colleagues in the BPO industry. As Richard has mentioned, I've been in the industry for quite a period of time. I saw it from less than 2,000 employees in the industry, and now with 1.2 million direct employees. And so it has been a fascinating and exciting journey that we've had over the last almost 20 years now. And certainly, I think those are with any growth and with any success, there's also some challenges, and that's something that perhaps one of the things that I'd like to share later on as we have embarked into this in this journey that we had in the BPO industry. But first and foremost, if I may allow me to introduce my company, I represent Genpact. We first started out in 1997 as the shared services arm of General Electric. So we were a part of a huge conglomerate. And then in 2005, we were spinned off. We became an independent company, and then started servicing not only GE but also other global companies. 2007, we became a public company listed in the New York Stock Exchange. And since then, we have grown to about 80,000 employees globally and operating in 20 countries. In the Philippines, we have about 6,000 employees across 3 sites. I do have a very soft heart with regards to developing our industry in the countryside. As Richard has shared earlier, we were the first one to put up a site in Baguio. And in Genpact, we were the first one to actually put up a site in Balanga City in Bataan. So this industry is very much in support of the government's countryside development, with maybe more than 30% of our population now in the countryside. And I guess that also becomes a focal point as we embark in terms of developing health and wellness in our individual companies, because in the journey that we have, especially dealing with the millennials, there are certain conditions and certain aspects that we need to really be very, very focused on. So, the thing about being in the same industry, you also have same programs. And that's something that as I was listening to the presentation of Paul earlier, I believe that we probably have the same thinking process being in the same industry. So I'll probably be just concentrating on some different points in the way that we are implementing our programs. So why have a wellness program? I think in the past speakers have been talking about how important health and wellness is, how it has become very effective in terms of being able to provide an environment for your employees to become productive, to be happy, to reduce their health risks. So when we embarked in this program about several years back, there was really an impetus why we did it. We started in the Philippines in 2006, grew very successfully, expanded throughout the Philippines as well as in Metro Manila. And we felt good. We felt good as an organization. We thought that we were doing everything right. And then in late 2016, we had a big wake-up call. Our attrition rates have shot up by almost 8%. Our productivity has gone down. It has affected our capability to provide quality service to our clients. And more importantly, our utilization rates in our HMO provider has really gone up to the roof. And for me personally, the one that really kicked me in the gut was when one of our teammates died. He had the cardiac arrest, the young age of 36. And when I went up to see his family, it was such a hard and sad situation. And therefore, that was really, for me, it became personal. Became personal to a point wherein immediately gathered our team and made sure that, I have been able to relay what we need to do. And we need to do it drastically. And that's the reason why, even with all the definitions of what a health and wellness program is, what are the benefits of it, it is the right thing to do. And that's really the impetus of when we actually implemented. Based to be healthy, it is trendy, but it is the right thing to do. So where did we start? And I guess, similar to what Paul has also earlier mentioned, data is key. We've gathered all the data that we have from the employee files to our HMO providers, from the clinics that we had, and I think most importantly, we had focus group discussions. Focus group discussions with our employees themselves. What was important? What was bothering them? What was the reason why all of these things are happening? And being part of GE, part of our DNA is Six Sigma. We deployed our master black belts to really look into the data, slice and dice it, come up with what are the root causes, and come up with insights. And that's what we used when we actually put the program design together. We stratified meaning that we attacked what was the most serious, and then later on come up with programs for those that are lesser in priorities. But certainly, I think it is very, very important that you first, define the problem, come up with a program design that would be attacking those problems on a specific basis. Certainly, for a global company, there will always be an issue with regards to budgets. There will be issues with regards to other priorities. And I think, one thing that we have done as far as the local team is concerned was then go back to the purpose of why we're doing this. And as I mentioned, this is the right thing to do. And that's for our teammates. And that's why, in spite of having challenges with regards to getting funding or getting approvals for certain types of initiatives that we are doing, we were able to do it simply because there was a certain purpose in what we're trying to do. And then, I think, it is also very important that you have the right resources. Since I was personally invested in this, I also picked the team members that were going to implement this. And these were not really just part of our HR, part of our... But I went across the organization and met, through these focus group discussions, who were passionate about this. And I picked them as our health ambassadors. And they became part of the team that also designed the program that we were going to implement. And I think that was one of the key factors why it became very successful, is because most of the ideas were grounded on data, which was presented to this group of ambassadors. They were the ones then came up with ideas of what are the programs that were that we believe were going to be effective in attacking the issue. The other one is, it's always well and good. You have a mission, vision, you got the plan to do it, but implementing it was the other challenge. Having millennials and having a young workforce, there's certain conditions that you need to understand what drives them. And I think if you answer all of these questions with regards to what you want to achieve, what is the goal, and how is it tied to your business objectives, it all comes to something that is then applicable and implementable. It was also mentioned earlier, communication plan is very important. If you don't have it, don't start it, because it's just going to bomb out. And that's really one of the first things that when we had already put the strategy together, I asked not only our team member, but we asked our global communication team to come up with a communication plan. And it's not just a communication plan, but also follow through with a calendar of activities, so that it would be very, very clear as far as what is the objectives, what are the things that we're going to do, what's in it for them, and what are the activities that we're going to do throughout the year. And in spite of all of that, you still have challenges along the way. And that's something that I think very important, is that you continue to ask questions, continue to get feedback, and so that you can then take that back into the team, so that you can then feed it forward for devising new programs, or revising a program that you think is not working out. So this is what we came out with this, which is the Happy Healthy Me campaign. And I think very similar to some of my colleagues in the industry, we've always put our employees in the pedestal as far as this program is concerned, making them happy, making them healthy, and certainly it's focused on them. So I just wanted to, I look forward to the discussions later on, because I believe that would help us in terms of being able to address some of the questions. But really, we found out that with all of these things that we've done through that 2016, 2017, our attrition rates have gone down by 7%. I think we'll end up by another 2% decrease in terms of our attrition rates this year. Our utilization rate has gone down by 17%, which has resulted into about 5 million pesos worth of savings. I think that would become 8 million this year. But at the end of the day, what the success factors that really came out to be is that we had happy, healthy, and productive employees. We've seen not only our attrition rates also go down, but also having our net promoter scores for our customers go high as far as 67%, which is in our industry is a benchmark. And it definitely sends a positive vibe not only to our employees, but to their families, and as a result, as I mentioned, is also to our clients. And at the end of the day, it simply makes good sense for us to have this program, and for us to be able to really bring back the vibe, bring back the happiness, and bring back the passion in our employee base. So thank you very much.